presentation on the adrenal glands. Each adrenal gland lies superior to each kidney in the retroperitoneal space. The gland itself has a flattened pyramidal shape. It's an endocrine gland, and in adults are about 3 to 5 centimetres in height, 2 to 3 centimetres in width, about 1 centimetre thick, and have a mass of 3.5 to 5 grams. It's during embryonic development that the adrenal glands differentiate into their two different regions, which are both structurally and functionally different. The cortex comprises 80 to 90% of the gland, and the medulla, which is located in the centre, comprises the rest. A connective tissue capsule covers the whole gland, and they are highly vascularized for quick and efficient transport of hormones into the blood. The cortex produces steroids and is divided into 3 zones, which each secrete different hormone. The 3 zones are the zona glomerulosa, the zona fasciculata, and the zona reticularis. The zona glomerulosa is located superiorly to the connective tissue capsule. Its cells are closely packed and arranged in ball-like clusters and arched columns. It secretes mineralocorticoids, which affect the mineral homeostasis of the body. The main hormone secreted is aldosterone. Aldosterone secretion is controlled by the renin-angiotensin-aldosterone pathway, and it comes in about 2/3 of the way in response to angiotensin II. Therefore, anything that stimulates the RAA pathway stimulates aldosterone activity. Stimuli could be dehydration, sodium deficiency, or hemorrhage. However, increased levels of potassium ions in the blood or intestinal fluid can also stimulate aldosterone production. Effects of this hormone are increased sodium and water reabsorption, increased secretion of potassium and hydrogen into the urine, and which results in increased blood volume and increased blood pressure. The removal of acids from the body helps to prevent acidosis, which is a blood pH below 7.35. Now, the zona fasciculata is the middle zone, the widest zone, and the cells are arranged in long, straight columns. It secretes glucocorticoids. These affect the glucose homeostasis, however, also regulate metabolism and resistance to stress. The main glucocorticoid secreted is cortisol, which accounts for 95% of glucocorticoid activity. Secretion occurs in response to negative feedback, where neurosecretory cells in the hypothalamus secrete corticotropin releasing hormone in response to low levels of glucocorticoids in the blood. This then promotes the release of ACTH, which is adrenocorticotropic hormone, from the anterior pituitary into the blood. Once this reaches the adrenal cortex, more glucocorticoids are then secreted. The effects of glucocorticoids are protein breakdown, gluconeogenesis, lipolysis, stress resistance, anti-inflammatory effects, and also the depression of immune responses. This last point is particularly helpful in the acceptance of new tissues after organ transplants. The zona reticularis, the innermost zone inferior to the medulla. The cells are arranged in branching cords and synthesize small amounts of androgens, primarily DHEA, which is dihydropianodosterone. This has masculating effects and promotes libido and is converted into estrogens. Secretion is stimulated by ACTH. The medulla produces 3 hormones called catecholamines. These are norepinephrine at about 20% of secretion, epinephrine at 80% of secretion, and in small amounts dopamine. It is a modified sympathetic ganglion of the autonomic nervous system, as it's made from the same embryonic tissue as all other sympathetic ganglia. However, its cells lack axons. The cells which actually produce the hormones are called chromatin cells, and the effects seen are an amplifying of sympathetic responses, or the fight or flight. Now, malfunction of adrenocorticoid hormones can actually cause death. This comes through dehydration and electrolyte imbalances. This can occur in a few days to a week. We'll also see congenital adrenal hyplasia, which affects the cortisol synthesis, and this causes masculinization of the physique, deepening of voice, growth of more body hair, and change in genitalia. When this happens in females, it's quite obvious for diagnosis, but in males, it can go underdiagnosed, as with confusion with puberty. We also see Addison's disease, which is not enough ACTH caused by, and Cushing's disease, which is caused by too much ACTH, and also Conn's syndrome, which is the zona glomerulosa making too much aldosterone.